Welcome to Open BXRx on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. Since 1996, Bronx Community Health Network has assured access to quality, affordable medical, behavioral, and oral health and related services here in our borough. BCHN has a new mental health initiative called Thoughtful Spaces. Here to share more about this initiative and more is Lechelle Lee, social worker, and Joanna Ocasio-Janvier, patient educator at Bronx Community Health Network. Thank you so much, ladies, for being with us today.
No problem. Thanks for having us.
So first, I gave a little intro, but for anyone who may not be familiar, can you share a little bit more about a Bronx Community Health Network and your mission?
So BCHN is pretty much a nonprofit organization. We've been around for about 24 years. Our mission is to ensure access to quality, affordable health care, regardless of your race, socioeconomic, or citizenship status. We have about 21 community and school-based health centers in our network and around the Bronx, and they serve about 114,000 patients a year. We're also extremely proud of our community health and wellness programs made up of our patient navigators, community health workers, and emergency room liaisons and health educators who actually reflect a wonderful Bronx diversity. And that team is a crucial link to integrating the healthcare, clinical care network and important community social support services such as our food pantries and SNAP for food stamps, housing, health insurance, jobs, and education that are necessary to complete wellness and optimum living for us, our Bronx residents.
Thank you, Lechelle, for sharing. And, we know that these resources are important and have been important to the community for many years, but how has BCHN helped provide resources and services to Bronxites throughout the COVID-19 pandemic in particular?
So our community health and wellness team continued to provide our social support services during the pandemic. And we celebrated the launch of our new outreach van in late February, but then pandemic hit, we were all locked down. But we were able to find ways to utilize the van during COVID and launch like a new food delivery initiative in May. And we also partnered with Montefiore Project Bravo Food Pantry. And now we deliver food from the pantry to families in need all around the Bronx.
That is amazing. Thank you. And let's get right into it and talk about your new mental health initiative. It's called Thoughtful Spaces for anyone tuning in right now. As we know, mental health is just as important as physical health, and isolation and loneliness during the pandemic may present specific mental health risk for many people. Can you tell us a little bit about how you're providing help through this new initiative?
So during these turbulent times where people's access to services are extremely limited, Thoughtful Spaces provides a new forum for outreach during using social media and the internet. And our initiative not only shows those in need that they're not alone in the struggle, but there's still an avenue towards health, stability, and recovery.
And who qualifies to get this help? How can they get it through BCHN?
Anyone can pretty much qualify. We don't really discriminate against anyone getting the services. We say you can email us at thoughtful-spaces at bchnhealth.org. And you could also give us a call at our hotline number, which is 929-220-8181. And that will give you access to someone who can help you get connection to any mental health services that you need, and even to a physician who can also assist as well.
Right, like Lechelle mentioned, it's a nonprofit organization, so we offer services for everyone. No one ever gets turned away. In fact, we try to, reach out to them as best as we can through the help of the van now during COVID-19 and giving food out. Like I mentioned, I'm a patient educator, so I work in conjunction with BCHN, but I don't work for BCHN. I actually work for Montefiore Medical Center. And so I work collaboratively with them in referring them to patients that need food, housing, legal, and all those avenues. I give them the referrals. But as far as my role, I work, in conjunction with Lechelle and other social workers in providing behavioral health triaging at the centers.
Right. Thank you, Joanna. And can you also help us discuss the stigma behind just talking about mental health in our homes and, the stigma that maybe the patients that you speak to and work with directly feel and face when it comes to talking about mental health? How can we start getting past the stigma and prepare to have healthy, constructive conversations with one another about mental health?
I think a way to start it is to have it be understood that mental illness is a disease that is treatable. And it's also not something that happens to a specific group of people. It can happen to anybody. Any situation can occur that can cause someone to really feel like they can't function with daily life. Everybody has their moments when they get depressed or they get anxious, but at a certain point is when it starts to enable a person to just do normal things. That is shows that anything can occur where you might need that extra help. And I feel providing education, being open-minded, and providing compassion are ways to promote a healthy, positive conversation about mental health. And that's, again, what Thoughtful Space is also a platform for. It can help someone that may need assistance in coping with a bad day to someone who may be struggling with thoughts and emotions and feelings over a long period of time. And that's why we, again, want to bring that out there to provide that and begin that conversation and be constructive about it.
Yeah, we've been I know in Montefiore we've been doing collaborative care, which is the whole team trying to really emphasize how medical health and mental health actually coincide with one another. Because if you're physically not feeling well due to diabetes or any or heart disease, you always get impacted by depression or anxiety because you're worrying or you're thinking you're gonna die. So we really work collaboratively, and that's how we've been doing this for over 5 years already through the medical groups and with the help of BCHN, who offer all these wonderful services for our patients. We just really try to make the push to really give as much help to the patients out there for mental health. So this is just another avenue through the social media platform. We know we have a lot of young people who are struggling, not just, all age groups from the pandemic. So we want to make it more accessible to the Bronx, especially.
Absolutely. I love it. And, just spreading the message that people are not alone throughout this, and using social media is an excellent way to, spread this message across and send that information and education to so many people who are already consuming social media, but, need an alternative or something else to escape just the convulsions of life right now. There's a lot going on, especially after elections finish and all these things and COVID-19, there's a lot going on. So just know you're not alone, and BCHN is here for you with Thoughtful Spaces. We're here talking about their new mental health initiative. So just to continue with our discussion, ladies, can we also talk about using mental health screening tools at home? I saw that BCHN shared a post with the following mental health screening tool on Twitter. We put the link right here below. It's screening.mhanational.org. Can you please share with our viewers and invite people to get screened online, but also follow up with a visit with a doctor in person as well?
Yeah, so I feel that those screening tools from MHS National, it's a great insight for a person to, inquire about possible symptoms that they may be experiencing. But I feel like it's strongly encouraged to seek professional help from a mental health professional. They are the ones who can really decipher what exactly may be going on with a person. Because those screening tools, they're really great, but they can easily, for someone who's not trained to use them, can be misinterpreted in a sense sometimes. And just following up with a mental health professional is a great next step to just get and seek that help that you do need.
And let's talk also about the importance of not neglecting your health during these hard times, and also seeing a specialist, whether it be for mental or physical health through the pandemic.
I mean, it's usually highly recommended for anybody to see our primary care physicians annually, just so we can ensure that we are all in optimum health. And getting access to care is even easier now, during the pandemic, because we had to, accommodate with these changes. For now, we use telemedicine. So now I know with that, PCPs are also incorporating mental health in their visits as well by asking a brief 2 questions in regards to depression symptoms. And usually if it's scored positively, they usually connect patients to mental health professionals who also do telemedicine as well. So if for some reason you are concerned, like you don't want to be outside, you don't want to be exposed too much, at least you have that access via telephone, via video chat, to get contact with both your PCP and also a therapist or a psychiatrist.
And having said that, they could also again contact the number that Lechelle gave for BCHN. BCHN, the community health workers, will outreach patients who are looking for a new primary care doctor because they don't have one. They don't reject any of the sites. We provide care to anyone who walks in. And so we are, the BCHN sites, the specific sites, they are federally qualified program. So you can pay as little as $0. As long as you need care, we provide care at the centers.
Right. Let's absolutely emphasize that, if somebody's tuning in right now and they're financially insecure, not sure if they can afford these services, can we just emphasize that BCHN also provides affordable healthcare to anyone who needs it, especially right
Absolutely,
now?
affordable healthcare, affordable medications at certain sites. So it's strongly encouraged for there should not be anyone without having medical care or mental health care.
Lechelle, before we go, thank you both again for joining us. Before we go, can we just provide our viewers with that number to contact and also the email once more, just so we can have it on screen?
So you can reach us by giving us a call at 929-220-8181. You could also email us at thoughtful-spaces@bchnhealth.org. And please also look at our upcoming social media at BCHN Health. We're having our hashtag Thoughtful Spaces, and we will provide a whole lot of information in regards to mental health needs and psycho ed, okay?
Perfect. Thank you so much, Lechelle and Joanna, for your time today and for discussing.
Thank you so
Thank
much.
you.
Of course. Again, folks, please remember to take care of your mental health as much as your physical health always. To find out more about the Bronx Community Health Network's new mental health initiative, Thoughtful Spaces, and other services and initiatives at the BCHN network, please visit bchnhealth.org and follow their social media at BCHN Health on Instagram and Twitter, and Bronx Community Health Network on Facebook. We'll be right back.